But what I found through my infertility journey was that it was a very lonely experience. At the time, I don't know if it didn't occur to me to look out for support groups, or if I was just, I don't know, embarrassed maybe, or kind of living in my own internal world. But I found it to be extremely isolating, especially, you go on Facebook and you see people posting pictures of their kids, or especially in the Jewish community. I mean, it's so family oriented in terms of holidays and going to synagogue and Shabbat meals and things like that, that I felt very often like this is so stigmatized. People don't talk about it. I don't even know who to talk to. And I just kind of turned inward. So I felt as though this is something that, in retrospect, after going through my journey, I wanted to help other women with. So after my twins were born, just a few months later, I actually decided to open up and tell my story, and held a meeting in my home and opened it up to, I was going back and forth about it. Like, do I talk about it? Do I not talk about it? This is so personal. Right. And this is embarrassing. But at the same time, I felt like this was kind of my calling and a mission that I had in this world to really support women who were going through this experience. My JFS for years actually went out, he flew out to Boston, and he did a training with one of the top, therapists and researchers in the mind-body connection. And he actually got certified to work with men who are experiencing infertility as well, or spouses of women and, couples and stuff like that. So we both really took this on as something that we're passionate about. And from there, as you had mentioned in my intro, we launched Nafshi, which is our Jewish wellness organization, and really the first program. And so we have all different kinds of support programs going on through Nafshi, but the first one that we ever launched was wombs. So I had these women come in my home. I had over 40 women come, and I told my story. And women started coming to me one by one and saying, like, I'm going through that too. And yeah, that's my story also. And it was like, wow. Like, I had one woman come and she just started telling me her story and bawling. And she said, I've never told anybody about this. And she had been experiencing infertility and doing treatments for 10 years. She had never spoken to anybody about it. It was like just so curled up inside of her that just being able to talk about it, even after that conversation, I just listened. I mean, that's all I do. I just listened. And even after that, she was like, that was so therapeutic just to be able to share that with somebody. So I've been working with Beth Bruto. I mean, I'm not a therapist. I'm somebody with the story, and I'm a good listener. But I've been working with Beth Bruto from JFS, who is a, certified therapist, and she really leads the group. We meet monthly, and she leads the group through various, meditations and exercises, and there's optional sharing. People can share, people don't have to share. And thank God, it's been really an unbelievable experience, and I've gotten such amazing feedback from people. It's been amazing to see people have children also over the years and drop out of the program. I mean, that's, the best thing. But also for people to find peace, at whatever stage of the journey they're at, to know that they're not alone. And what we try to do is really create a safe space where people can share, and there's no advice giving. And, and I also recognize that a group setting is not for everybody too. But my recommendation, based on what you were asking in terms of the experience of being, alone or community on the journey, is to find somebody, whether it's a group, whether it's a close friend or a mentor or a therapist, but to find somebody to be able to share with, so that, I think that there's a healing process in that. So I hope that answers the question.
Yeah, I mean, it's totally validating, and it really helps a person kind of just have that emotional support and just know that someone is really caring for them. I think it's really a crucial piece. My second question to you is, people, despite their best intentions, can sometimes say the wrong thing. What are common mistakes that loved ones say to family members or friends who are struggling to conceive, and how do you recommend they phrase things instead to be as supportive as they can be?
So yeah, this is a really touchy prompt because it is so emotional. First of all, like, I'll tell a personal story. I remember being in the lunch line. I'm a school teacher, and I remember being in the lunch line going to buy my hot lunch. They let the teachers, go and buy the lunch, whatever, with the kids. And I hadn't pre-signed up that day. Okay. So I go in the line and I say to the lunch person, they have catering, whatever, at the school. I said, I didn't pre-register, but is it okay? And she was like, we really need you to pre-register. All these other students in the line here, they pre-registered. You're going to have to wait at the end of the line. And once all of the lunches are out, if I have more, I'll sell it to you, which is totally reasonable, right? Because the students should come first. They paid for their meals. I didn't. I broke down. Okay. I literally broke down and I was like, I can't believe it. I'm a teacher in the school. And I have to go upstairs to teach, and I'm hungry. And she was like, it's going to be okay. And I seriously lost it. Why did I lose it? I was so pumped up on hormones and going through an IVF cycle that I was not a normal person. Okay. She happens to be a good friend. So I thought I was singing at you. I really was not in a good state. Okay. My point here is that when people make comments and they say things like, you've been married for a while, what's going on? Or whether it's your mother or your mother-in-law or a friend or a complete stranger. Yes, complete stranger. I was in a music class once and somebody turned to me, and this was when I actually had one child before I had more, and he was already older and I hadn't had more kids yet. And she said to me, she's like, oh, you have other ones at home, right? And I'm like, no. And she's like, I thought religious Jews have so many kids. I can't believe it. And I was like, oh my gosh, did you actually just say that? So first of all, yes, people say really silly things, okay, and insensitive things. And second of all, it's even more compounded when you're on meds or just miscarried or just whatever. Everything is that much heavier. So what I would say is, for those of you who are going through the infertility process and listening to this, I would be real with those emotions. I mean, it's painful and it's hurtful to hear those things, and it's okay to be upset about that. Once again, I'm not a therapist, but I've been to a lot of therapy, and my husband's a therapist. But it is okay to be upset about that, and your feelings are valid. Okay, that's number one. For those of you who are on the other side and are wondering, oh my gosh, I know my friend is struggling, but I don't know, should I say something? Should I not say something? Do I invite her to something? But there's going to be a lot of kids there. Is she going to be offended? Is she going to be uncomfortable? I would say that it's always nice to invite people. People always like to be included in things, especially people who don't have children. It's their choice if they want to not come. They can decline the invitation, but holidays like Purim or things that are very child-centric, people who don't have kids a lot of the time just get left out of that, and it can be really isolating. So I would say it's always nice to extend an invitation. I wouldn't pry, and I wouldn't ask people questions directly in terms of when are you having kids, or what's going on with you? Is something going on? If somebody wants to share and they open up the conversation, then be there to listen, but not to in any way pry or ask questions. I think it can be really uncomfortable and touchy for people because you don't know what situation somebody is in. And the other thing is, for the people who are experiencing infertility challenges, to also recognize that people don't mean to hurt you. People really, they just don't know. And that's why this is so important, Caryn, what you're doing here. And the Priya and educating people is breaking the stigma and helping people realize what is appropriate, what's not appropriate. And, there's an education process that needs to take place. And so we're taking those steps. So
Beautifully said, Nikki. Thank you. I think you really covered a lot of ground, and, really the different sides of it, being the person who's making the comments, and then being the person who may not be comfortable to share their story. And I think it's really important to recognize the sensitivities on each side. So thank you for sharing your story and for, uplifting so many women and giving them that courage to be able to open up, whether it's to you, to a friend, or just whatever it is, so that way they can feel that support that they need too. So thank you so much, Nikki.
I don't know if the people registered are going to get our contact information also. Yes. Maybe that can be a follow-up email. That way, if people are interested in more specifics about wombs or want to get on our mailing list or know about meetings or just speak with me individually, I am happy to be a resource for you however I can.
Yes, thank you so much. And we are going to send an email after this Zoom event. We're going to send it to all the participants with a link for each of the speakers' contact information. And if they want to reach out to you at Nafshi or to Priya or JFS, for the help that they need, then everybody is welcome to contact us. So yes, so thank you so much again. Appreciate your time and your wisdom to share with everyone. Our next speaker I'd like to welcome is Dr. Jerald Goldstein, who is the founder and medical director at Fertility Specialists of Texas. He is board certified in both obstetrics and gynecology, reproductive endocrinology, and infertility. Dr. Goldstein is the author of scientific publications in peer-reviewed journals and has lectured on a variety of topics related to reproduction and fertility. In addition, he has been voted a Best Doctor in D Magazine for numerous years, and most recently in 2021 in Collin County in Dallas. He is a member of the medical staff at Baylor Medical Center in Frisco, as well as Texas Health Presbyterian Hospital. Dr. Goldstein is a member of the American Society of Reproductive Medicine, American College of Obstetrics and Gynecology, as well as the Society for Reproductive Endocrinology and Infertility. Welcome, Dr. Goldstein.
Thank you.
Dr. Goldstein, this field has grown tremendously over the last couple of decades. There is so much to take in on this subject, but to simplify it for our audience tonight, I was wondering if you could share with us, when should a couple see a reproductive endocrinologist, and what are some treatment options available for couples to help them conceive?
Well, thank you for that very gracious introduction, Caryn. Initially, I would say that one thing I wanted to second what Nikki was saying, that it's always been amazing to me how lonely it is, just to get to the point where somebody will actually come see a physician. I know that, that in the past it's been something that's kind of been hidden, but now it's amazing when you go and you talk to other people, other women. It's amazing that you mention about fertility, that you'll find out that a lot of people are actually going through treatment, and luckily a lot of them are actually getting pregnant. And I think that it's always been amazing to me how medicine really hasn't really addressed that part, at least medicine from the fertility perspective. In regards to when you should go see a doctor, I think that, women are actually are very intuitive. And so a lot of times if you typically, the recommendation is if you're under 35, that you should wait for a year. If you're over 35, or you should wait 6 months. But if, for example, if you have irregular periods, for example, then instead of waiting for a year, that in itself is going to be a reason why you would really want to see somebody. And, and the sooner you see someone, the better. If anything, just to get information in terms of where, like a baseline of where things are at. If, for example, you have a history of, endometriosis, for example, that would be a reason to see someone, sooner. Or if, 30% of the time it's actually the male that was often left out in terms of the evaluation. And so if, for example, that your husband knows, for example, knows that they've had some prior injury, history of, maybe undescended testicle. I mean, there's a number of different reasons can make it where that can affect the ability of the sperm to fertilize an egg. And so in those cases, that you should really see someone before the recommended time. If for any reason, just to have a baseline of knowing where you're at, and I find that a lot of people find that very comforting and and helpful in terms of making it where it's not so you're not so worried that there's something underlying that you don't really know about.
Right. It's true. It definitely helps to get checked, and having that knowledge really helps you make more informed and educated decisions and really become proactive on whether you have to do a treatment and not waste any time. So that definitely helps. Can you help our audience understand the length of time commitment and how many cycles of treatment on average does it take to have a successful full-term pregnancy?
Well, I would say the first thing is that, typically when you come see a fertility doctor, it's really just getting answers. So basically you're going to sit down, and now actually it's through Zoom, believe it or not, which has actually been very effective in terms of being able to, get a history, understand what's going on, and then basically coming in and doing like an ultrasound that allows you to look at the uterus, to look at the ovaries, to measure all the small little follicles in the ovary called the antral follicles, and to get an idea of what that is, to look at the uterus, to make sure you don't have a history of fibroids or uterine polyp. We typically do genetic screening testing in terms of blood work for where you can test for hundreds and hundreds of different diseases. Of course, in the Jewish population, there are some diseases such as Tay-Sachs that are your increased risk of carriers. So all those things are typically screened for. Getting hormone levels such as AMH, for example, which gives us just a rough idea of your egg count, checking your thyroid, your blood sugar, and then of course looking at the fallopian, doing the sperm count and looking at the uterus and the fallopian tube. So that's basically just a baseline information, and then after that, typically you meet with your doctor, go through that testing, and then come up with options. Typically, the options now are, things of the success rates of assisted reproductive technology have really improved tremendously, whereby for the most part, it's really unusual for someone not to be able to get get pregnant. It's just a matter of really how aggressive you want to be. But typically, it starts off with being on medications that would really increase the number of eggs that you're releasing. So if you typically women release one follicle a month, between days 12 and 16 of their cycle. And the idea would be is to be on medications to increase the number of eggs that are released. So if, for example, one egg doesn't get fertilized, that you still have a couple of other follicles. With that comes the risk of multiples. So now you notice that there's been an increasing discussion about IVF, primarily because the success rates have become much higher, and the risk of higher order multiples are much less. So I think that our goal is really a single pregnancy. As I'm sure a lot of people know that one baby is life-changing, and two at the same time is good. But the thing is just that it's really the goal is the goal is really one. And so basically IVF has become is typically someone would do 2 to 3 months of treatment with oral medication and injectable medication, and then if they're not pregnant, then you would meet back and discuss options. And I think that the other thing is, I always like to say that there's the medical part of it, and then there's the physical and emotional part, and that's like a separate part. Trying to get pregnant is frustrating, so it's important to talk to your husband, obviously, but it's also, and I tell people, except for for example, maybe, I mean, I know Nikki Friedman's husband really has a really understanding, but also for women to talk to other people, not including their husband in terms of the other women, because it's very, men and women are different, and men, perceive things very, very differently. And so sometimes can be very frustrating about going through a process. It's very difficult, and you want to have someone you can talk to that really understands really what you're going through. And I think that's, I find that really helpful. And so that's why I think that, for example, discussion groups like what Nikki's saying is, is really like an amazing process, because that part of it can be so, carry such a heavy load, and we don't really, at least certainly from a fertility clinic's office, don't really have the ability to address a lot of that.
For sure. It definitely helps to have that support system and to just be able to get through. And whether it's, like Nikki had mentioned, whether it's 1 year or 5 years or, something in between or longer, it just helps to be supported along the way. You don't know how long it's going to be. And so it really does help to open up and have that support. So thank you. And one more question. If someone were to ask, as a family member or as a friend, is there anything that I can do to help? What would you say?
Yeah, I mean, I would say listen. You know what I mean? It's like that. I guess you're talking about not in terms of giving like advice necessarily, but just listening and being understanding, and also hopefully being able to provide hope. Because I think that in the process of going through, I often feel like that it's so easy to lose hope and to feel like that, it's just maybe, everybody, it's like you hear, you hear about everybody that's getting pregnant and this, and it can become very, very frustrating. But just listening to someone and hopefully being able to give them hope and saying, that if you sit down and you really understand what's going on one way or the other, it's gonna, it's gonna work out. And I guess that's what I would say would be, that's what I would recommend.
That's great. Thank you so much, Dr. Goldstein. It's definitely really helpful to have that information about what to do when, if something is not working right, and just listening to your own intuition. Like you said, women are they are very sensitive to that. And I feel that that's a very important piece in the fertility process. So thank you so much for your expertise on the subject. Our next speaker I'd like to introduce is Dr. Ron Friedman, who is the assistant professor in the Department of Psychiatry at UT Southwestern Medical Center. He is a licensed psychiatrist and board certified by the American Board of Psychiatry and Neurology. Alongside his general adult psychiatry training, he has a special interest in training and treatment of women's mental health issues across the life cycle. Dr. Friedman provides emergency psychiatric services at Parkland Hospital, where he also provides psychiatric consultation services to the obstetrics and gynecology's labor and delivery unit. In that role and in his private practice, he helps women who are affected by mental illness and emotional distress at the stages of family planning, the perinatal period and postpartum period, by optimizing their mental health. Welcome, Dr. Friedman.
Caryn, thank you for inviting me for this.
Of course, thank you for being here. Dr. Friedman, so what are some of the struggles that couples face emotionally with infertility? And what are 3 practical tools that you can suggest to a couple going through infertility?
Yeah, so I think it's important to kind of think about it in 2 ways. The obvious external struggles that include, the physical strain, the financial strain, the time spent waiting and then going through treatment. But then there is a lot to be said about the internal struggle, the psychological, impact of both of arriving at a diagnosis of infertility, but also going through the treatment and how it affects the well-being of the individual, but also of the family as a whole, right, of the couple.
Sure.
So things that are commonly, and I do want to make kind of one statement, a disclaimer. Okay, as I list some of these things, I think that it's important to remember that this is such an individual process, and the response is such an individual response. So I think that research and statistical data cannot possibly apply to everybody. So it's possible that some of the things that I will list will sound very familiar and close to home to some people, but very distant and unusual to others. And it's also important to recognize that individuals who never went through therapy and don't have necessarily the access to their emotional intelligence may not recognize some of these things, and this is why it's important to. So this is my disclaimer about it, and I am happy to address any comments about any of that, of course. But I think that it's important to think about several things. First of all, adjusting to the reality, which is markedly different than a lifelong idea of what the spirit should look like and feel like. Dealing with the disbelief sometimes, right? It's not always recognized and not always expected. So sometimes there's dealing with the disbelief of a diagnosis. There is sudden an increase in time pressure. So people may have different ideas for their timeline of wanting to become pregnant, and suddenly that clearly changes. With that, I think that the most common feelings are anger, depression, anxiety that can lead to marital problems, sexual dysfunction, and I think that as demonstrated by some of what Nikki pointed out, feeling of social isolation, whether it's perceived or true. Some couples may sense loss of control, diminish of self-esteem in the setting of their infertility, and then there are two types of emotions that I feel like can cause a lot of distress. One of them is really envy and resentment, which is often something we suppress, right? I mean, we don't often pride ourselves with those feelings, but that can come up and cause distress. Those feelings can cause distress to the person who experienced them. And then when it comes to shame and self-blame, I think there's kind of something interesting in the literature about often, and also I think Dr. Goldstein, you kind of referred to that. Often the male partner would not necessarily experience the same things, and it's perceived by some that the level of distress is not matching that of the woman who goes through infertility treatments in many cases. But interestingly, when the cause for infertility is identified clearly to be due to a male partner, then the males do experience similar distress, and I think that kind of it says a lot about this kind of self-blame and shame that is often associated with that. When it comes to depression and anxiety, there's an estimate of major depression prevalence, or anywhere between, and it's a pretty large range there, but between 15 and 50 plus % of couples would experience depression at some point, and anywhere between 8 and 30% of couples going through infertility will report a clinically significant anxiety. One thing that Nikki also mentioned that I thought was important is the experience of a miscarriage, and often it's not something that is thought of early in the process, but it for many it will become a reality, and so we know that again, statistically speaking, we know that early pregnancy loss is common, and it can be up to 25% of total pregnancies. And the emotional consequence for most women would be that they would be doing well. They'll cope with it and they'll do fine. But similarly, if you compare women with viable pregnancies to those who had early pregnancy loss, there is twice the likelihood that they will experience clinically significant depression, and 4 times the likelihood that they will experience. Actually, it's the other way around. It's 4 times the likelihood they'll experience depression, and twice the likelihood that they'll experience significant clinical anxiety. So I think that kind of putting it all together, I think that in short, might be too late to use this term right now, but in short, I think that the range of struggle, both emotionally for the individual, for the couple, is quite variable between individuals, between couples. But in general, these are the things that as a mental health provider, I would look for and make sure that we kind of monitor.
Right. Very well said, Dr. Friedman. And it's true that, a couple who's, experiencing infertility, they just think how could this be happening? You would have never thought that such a thing would happen, especially to me, And so it does bring up all of these emotions in a way that can take a toll on the woman, on the man, on the husband, or on the couple together. And it adds, it can be very stressful. So, yes, you touched on it very nicely. So thank you. And if we have a little bit more time, I would like to say, this question is for you, Dr. Friedman. Nikki, she started to shed light on what to say and what not to say to a couple experiencing infertility challenges. So if they are beginning to open up to a loved one about it, can you share a clinical perspective to help guide the conversation with their friends or family?
Yeah. I think that it's important, again, to recognize that this is a highly individualized process. And the experience is different for each person. I think that actively thinking about active listening is what I would recommend, because it can be, the need might be different in different times. I think that, a story about someone else who was successful, can be encouraging early in the process, but can be very, very hurtful in some ways late in the process, right? If you're not succeeding. So I think that it's important to remember that it's not only that every individual will have different experience, but even the road to birth can take so many forms in this situation, and I would urge friends and family members to first listen and remember that it's not always necessary, and it's almost recommended to not always offer advice. Sometimes all that's needed is a friend or a family member to listen, to share the pain, to share the frustration, to share the anger or the joy, and be there for your loved ones. And I think that it's also important, and I do want to kind of plug it in the situation. It is important to listen where someone who goes through the process is under significant distress, and make sure that they do reach out to a mental health provider, either a therapist or a psychiatrist. I think that that's something that I would urge others to pay attention to. Sometimes it's the hardest part for an individual is to recognize and admit that they need help. And so I think that, as we all kind of mentioned in different ways, the struggle can take many forms. And definitely, I do want to add one more thing here. There's a lot of data to suggest that those future mothers who are caring for their mental health do have a higher rate of success earlier in the process, and so I'm not going to go into the mechanisms and why and so on, but I think it's suffice to say that there is direct correlation between stress and mood and the success of insemination according to variety of literature. And so I do recommend to consider that. And locally, I think it's important to kind of, again, this is a little bit of encouraging others to seek this help. We're fortunate to have a pretty nice network of women's mental health providers. So outside of myself, there's Dr. Matan White, who many in the community may know, Dr. Yarpak Harrison, who many may know, and at UT Southwestern they have Dr. Robin Jarrett, who is a nationally renowned CBT provider, and focusing on women's mental health. So I think that my final point would be seek help. It can help with the process. If nothing else, it can make you feel slightly less distressed and hopefully more supported.
Yeah. Thank you so much, Dr. Friedman. These words are very encouraging because it really gives people the strength to pick themselves up and get that help that they need. And once they make that first step, they will get the support. And if anybody is looking for resources, please feel free to reach out to me privately. And I have a list of resources in our Dallas community, which we are very fortunate to have. And, we have Nafshi, and we have JFS and Priya, and there's lots of resources, and we're happy to share that with the community. So thank you so much, Dr. Friedman, for your insight.
Thank you.
Okay, so our final speaker for the evening is Rabbi Yogi Robkin. Rabbi Robkin studied in the prestigious Ner Israel Rabbinical College in Baltimore, Maryland, and received his master's in education and administration from Loyola University, Chicago. His personal Jewish journey allows for a unique point of connection to other students beginning their own Jewish journey. Rabbi Yogi appreciates discussing the hard questions in life and is known for his interest and openness to discussing even the most taboo of subjects. A class with Rabbi Yogi is sure to have you laughing at his jokes and enlightened by his wisdom. Rabbi Yogi enjoys playing and following sports, inviting people to his exciting Shabbat meals, and having deep Starbucks conversations with students and friends. Welcome, Rabbi Robkin.
Thank you so much for having me.
Of course. Thank you for being here. So my question for you tonight is, in a community where family is the center of our culture, how can we sensitively and thoughtfully include those struggling with infertility as a Jewish community?
Yeah, it's a great question. And the speakers before me have addressed this question in a beautiful manner. I guess I'll add a particularly Jewish twist to that, because I think that's what I'm here for. The Torah goes out of its way to talk about particularly vulnerable individuals that we have unique obligations towards. So the Torah says that you have to care for a widow. The Torah says you have to care for an orphan. The Torah says you have to care for a stranger. And I think the obvious question is, we have a general mitzvah. There's a general commandment, love your neighbor as yourself. What do you have to point out these particular individuals? But the answer is that we actually have to go above and beyond for people that are in a vulnerable situation. Yes, you've got to love everyone as yourself, but you have to take particular focus and particular notice to the people that are feeling vulnerable. And obviously, the people that the Torah is talking about a stranger to a new land, a widow, an orphan. These are people that are physically vulnerable, financially vulnerable. But we have people equally in our communities that you can extend this concept to, and that's people that are emotionally vulnerable. And people that are struggling with infertility fall under that category. They may not be a widow, but in many ways they feel deeply connected to the concept of loss. They may not be an orphan, but to a certain extent they imagine looking at their own children as orphans that aren't there even. And so these are people that are struggling and they're vulnerable, and the Torah says you've got to take particular notice of them. And the reason why this is so hard is that we tend to notice other people like us. I was just at a meeting last week, and a woman was there who has a 1-year-old baby, and she was saying how refreshing it is to have adult conversations with people. We were at a coffee shop. It was really nice, one of these first outings after getting vaccinated. And she said, it's really just so nice to be with adults. She said, because my life is really baby and mommy centric. And I think that's very normal. When you are in that stage of life where you have a baby and you're a young mom, you tend to relate to other mothers with young babies. And that's your world. And what ends up happening is that by no conscious decision of your own, you might come to neglect a lot of people that are in your social circle that aren't young mommy having a young baby. And that's what leads a lot of people with infertility in the Jewish community, which you mentioned, which is so family-centric. And because of that, we do have families at younger ages, and we're very focused on family. Oftentimes, they really do feel left out. And so what the Torah is saying when it says to care for these particular individuals, it's saying the Torah is challenging us to see beyond our normal scope. If our normal scope is baby and mommy centric, let's expand that scope. Recognize the fact that your scope is limited to people that are in similar life stages as yourself, and put yourself beyond that. We do that on Friday nights. I have 5 children. Every Friday night we have a widow at our Shabbos table. And of course she's a friend because she's been coming for many, many years now. But every time she comes, I specifically think I should have intention to fulfill the mitzvah of reaching out to a widow. We're not in the same life stage. I'm 40. She's in her late 70s. I have a family. She's living alone. We don't really have a lot in common. And that's what the Torah is doing, is it's challenging you to widen your scope. And that's really what I would tell a Jewish community. Work on widening your scope. Don't allow your eyes to cast their shadow on only the people that you would naturally hang out with and connect with. Go further, stretch a little bit beyond that. Invite them for your Shabbat meals, and make functions. If you're at a synagogue, if you have the ability to create functions where singles are vital to that, create Shabbatons for them, create those opportunities. And I did want to tell you, Nikki was talking about people saying insensitive comments. I remember, I'm a guy, so I completely didn't relate to this, but later on I was like, wow, she really knew what she was talking about. When we were young and we had children right away, and she had a good friend who was married just a little bit after us and was struggling with infertility, and for many years. And I didn't know this, but my wife one time pulled me aside and she said, I make it a purpose, even though we have little kids, to go and make sure to spend time with her, because I'm not finding other excuses like going to the park to hang out with other moms and babies. I make time to specifically go and spend time with this friend, and I never speak about our kids. And, just because that could be painful for her. And what was amazing is, thank God, she ended up having a bunch of kids, I think, with the help of modern medicine. And she actually reached out to us. It was pretty amazing. And maybe 20 years later, and said, I just want you to know, don't think I didn't notice that you made time to be with me and that you never spoke about your children, because it was so sensitive for me. And all the other friends of mine who had young children were talking about their children, because that's what you talk about when you're a young mom. And it was so hurtful. And I knew that being around you, I could always just let my guard down. And I thought that was really, really special. And I just want to leave you with one last idea about widening your scope with this question. I remember I was studying in yeshiva, and I heard a rabbi ask a question which never really occurred to me. And that was, why do you think, it's a question for everyone to think about, why was it that Abraham becomes the father of monotheism? Why him? What's so special about old Abe? What did he do that made him worthy of being such an important person on the Mount Rushmore of Judaism? What did he do? And this rabbi gives such a beautiful answer. He says, you have to understand, Abraham was known for chesed, for kindness. He was the one who invited the Arabs into his tent, even after his circumcision. He was chesed-centric. He was focused on other people. And he said, a person who can see beyond themselves and see the needs of others can also see beyond this world and recognize the one God that's invisible to most people with limited scopes. And that's a beautiful answer. And so there's a lot of blessing that comes with widening our scope, and Abraham discovering God is part of that blessing.
Wow. Wow, Rabbi Robkin, that's really incredible. And the stories you shared it just goes to show that how if we take these tools that you mentioned about widening our scope, we really can make a difference and can make other people feel comfortable and share and be there for them and supportive for them in their struggle. So I think this is a great way to create space and to make others feel part of our circles and being inclusive. And it's really important to widen our scope. I think that's a great lesson. So thank you so much. I wanted to thank everybody so much for coming on for this important, informative event. If you have any questions, you are welcome to message me privately, or you are welcome to unmute yourself and you can ask any of the panelists.